Hello and welcome to this online course which is focused on the topic of adolescent depression. The course is designed for people who work directly with young people who might be depressed or are parents of young people who might be depressed, so people in the very front line. And we've made this course because we're aware that there's a lot of publicity around at the moment about adolescent mental health, and naturally lots and lots of concern about the impact of depression on young people and how it might affect them now and going into the future. What we want to convey is good news really. There are a lot of effective treatments for adolescent depression, and parents, teachers and other people who work with young people can be a real source of support and practical help to young people, and we hope that this course will show you how that can work. Across the 5 weeks of the course we'll hear from lots of different people. We'll hear from young people themselves about their experience of what it's like to be depressed and their experience of treatment. We're going to talk to some parents about what it's like to live with a young person who's depressed, hear from a teacher to talk about her experience of working in schools and what it's like to work with young people who have got depression. We'll hear from some experts who understand adolescent depression from a research perspective, and we hope we'll also hear from you on the online discussions where you can post comments, ask questions and discuss the topics with each other. In week 1 of the course, we're going to focus on what depression looks like, what it's like to be a young person with depression, and how, as a parent or a teacher, you might begin to recognise when a young person is becoming depressed. We'll think about how depression is different from normal low mood. We all have periods when we're not feeling great, when we have periods when we're quite sad and upset, but that does not mean we're depressed. So what we want to do is to be clear about what depression is and how it would be different from when a young person is just in a bad mood or sad. If you do decide that it would be helpful to talk to somebody about your son or daughter's low mood, or you'd like to advise somebody to seek help for depression, who should you talk to? We're going to talk a little bit about what help might look like, what kind of support is available, and what treatments tend to be useful and effective for young people with depression. Because often adults, parents and teachers are concerned about the risk of self-harm amongst teenagers and young people who are depressed, we will spend some time thinking about self-harm and really try and offer some practical advice and some information about how to minimise the risk of self-harm in young people. The last thing we'll do is think about what is it that causes depression. So we're going to take a psychological approach to this and look at some of the main psychological explanations for the causes of depression and how those help us approach the treatment of depression in young people.